to Yesterday, Today, Tomorrow. My name is Mariana Cordier, and I am your host. Many of us are tired of being home and want or need a vacation. My guests today are going to discuss the issues surrounding the hospitality industry, travel, cruise lines. What do we do? When can we go? So my first guest will be Jeff Brainard. He is the VP of Sales and Marketing for Southern Management Companies. And back to join us, Commander retired Stephen Blackwell. He's with the EHA Consulting Group to talk about cruise lines and COVID. So gentlemen, thank you so much for joining me. And I'm going to start with you, Jeff. I really am interested in going somewhere, but I'm scared. So tell me, what has the hospitality industry done to make sure we'll be as safe as we can be?
Well, first of all, we're very excited to host you, so we hope you travel with us. But I think the hospitality industry has actually done a very good job. It's one of the few businesses that stayed open through the majority of the shutdown as an essential business, taking care of families and guests. And we've learned throughout the pandemic, one of the things that we do well, and hotels have always done well, is we run clean operations. We're used to cleaning up after guests and making sure that they're clean, no evidence of past guests, things like that. And we run very clean operations. Well, this was taking it another level with public area, everything from elevator buttons and rails and using use of PPE and how you take that to the next level. So most hotels, including ours, came up with programs to supplement the American Hotel and Lodging Association Safe Stay program. We came up with a program at Southern called Everstrong, and it's based on a number of different pillars. But most important, it's rocked in cleanliness, but also communication as well as rapid response. And if something happens, we're going to let our guests know. But more importantly, we're going to do what we do well, and that is take care of guests. Utilize the space that you have at the hotel, clean effectively, and then put in practices that encourage people to travel. And then as things have progressed, our teams have continued to improve in that, and guests have gotten more and more comfortable with mask orders and spacing and really just how to travel safely and comfortably. Because if you're comfortable traveling in your family unit, multiple family units can be in a hotel because everybody's generally doing the same thing. And as we progress through this, I think the education of the guests, along with what the hotels have done very well, has really encouraged people to travel and feel comfortable doing so.
What's different about a hotel stay now as opposed to pre-COVID?
I think there's a couple of things. One, the personal touch is still there, but the proximity isn't. You're still going to get a smile, but it's with your eyes behind a mask and possibly a plexiglass screen at the check-in. You're going to have a greater use of technology in a lot of hotels, whether whether it's a keyless check-in or just passing keys and using QR codes versus menus. Inside your guest room, you're going to have less collateral. You're going to be using your TV or a QR code or a website for your guest directory. So there'll be less printed materials and things. And probably most importantly, you're not going to get, in most hotels, you're not going to receive daily housekeeping service because you're going to limit the interactions inside of guest rooms. Now, that doesn't mean you can't get service. You can certainly request different items, but how the service is delivered from a distance to promote safety for the team member as well as the guest, that's going to be pretty much universal. The stay experience itself, though, is going to be largely the same. You're going to have comfortable rooms. You're going to have clean linens. You're going to have great views. And you're going to have people that want to help. And that experience overall, I think, is really what a lot of people are looking for, just finding help in a different way and learning what that spacing and use of technology does. But we still have a lot of team members that are there to make sure you're taken care of. So if you've been out to a restaurant in the past couple of months, you just see how things are a little bit different. Hospitality is very similar in that few less touch points, but still a great experience overall.
And so hotels are very different from cruise lines, right? Or they're moving hotels, if you will, Steve. And I'm curious. I think I heard that the cruise line industry is going to try to open up and start cruising in June. What do you know about that?
Well, there's a series of steps and everything on a cruise ship is very similar to what was just mentioned about hotel spaces in terms of touch points and social distancing, maintaining and mask wearing and physical barriers such as plexiglass and other things like that are part of the COVID protocols that the cruise ships will use as well. But they're unique in the sense that they are all in contained environments. So they're supplying their own water, their own electricity, everything within the environment of the cruise ship itself. The crew members are housed on the ship as well. So there's that factor that is different from a shore facility. Plus, there's a little more regulation that they have to go through because they're international businesses as well. So the Centers for Disease Control is issuing conditional COVID sale certificates. Right now, all the cruise lines, there's a color-coded system for cruise ships. Each cruise ship is either in red, yellow, orange, or green status. And all the cruise ships listed on the CDC's website are in green status right now. None of the cruise ships are actually sailing from US ports and taking passengers currently. They haven't for over a year. The first scheduled ones have been requested for actually July, but it has not started yet. So they're in the process. The CDC did just issue another guideline to move to the second phase to obtain these certificates. So, and part of that is daily reporting of any COVID testing. The color-coded system basically indicates if there's any COVID-19 illnesses on board the ships, how their testing protocols are, and those are within the crew members on board the ships. And they're reporting directly to CDC all the illnesses that are on board these ships for all the ships that intend to sail to a US port. They also have to coordinate with local authorities, and this is where the hospitality industry doubles up, because they have to have places to potentially house people if they need to evacuate a cruise ship. So they're working with hotels and other potential housing options. They're working with hospitals to make sure that they have places to evacuate sick patients if need be, and they're required to work with every local port that they may visit, and that's each ship, not just each cruise company, but each ship working with the local port authority and the local health department within that port authority's jurisdiction. So there's testing going on, or there will be testing, and there's potential for the next phase, which will be simulated cruises. So they're actually going to require the cruise lines to go out and pretend cruise with volunteer passengers, and they'll assess the protocols and how effective they are at maintaining them during the cruise. So it's a long process.
Yeah, it sounds like it's a long process, but cruise ships have had different issues. They've had different outbreaks of people getting sick from the food or whatever. And how hard is it to disinfect a cruise ship? I mean, to me, it sounds like something that is riskier than a hotel room, for instance.
It's really not much different in terms of the touch points. The cruise ships have refitted some of their ventilation systems to add filtration that is stepped up. It's also they also have to be able to isolate on board as well, so they can do that, and they have to have protocols for all those. So it is very similar when you're talking about the hospitality areas of a cruise ship and a hotel when it comes to the disinfection protocols. What makes it different is the international aspect of the cruise ship and the floating environment that is contained all in one area.
And with regard to hotels, Jeff, I heard you mention that you guys have also updated your HVACs and your ventilation systems. Is that correct?
Well, at Southern, we're actually lucky we have great systems. So what we did is we looked at a lot of guidelines and talked to experts and made sure that our systems not only complied with whatever the guidelines were, but exceeded them. In most cases, we've standardized our filtration for our events in public areas, but they already exceeded. Like we have ultraviolet light sanitation in one of our ballrooms. We have automated CO2 sensing so that if you have an outside air percentage coming in, that if you have more people in there and that CO2 comes up, it automatically adjusts to increase the outside airflow. All of it is about how much that air exchange and circulation, goes into that room, so that you're constantly filtering and changing the air. So when you add that along with spacing and then allowing clients that are having meetings, if they have company guidelines, to be able to say, hey, our standard is to have 60% or 80% outside air for all of our spaces, we can make that adjustment. We can customize the event experience from an HVAC standpoint for our clients. And that's something that not a lot of companies can do, but it's something that people are asking now, because obviously those are the guidelines. So companies are coming up with standards to obviously keep their team members and their guests and their clients safe. So as we adapted our program, it was making sure we had the ability to customize and create that unique environment that clients need.
And how do clients or guests find out which hospitality groups have that kind of system and care for their well-being?
Well, part of that's my job as a sales and marketing guy. I got to make sure I get the message out. But it really is. It's a two-way street. We need to communicate that and make sure that information is out there. But there is now, especially on the meeting planner, a greater sense of responsibility for safety and protocol, which really hasn't been part of the program in the past. It's been, is the event right? Do we have the right audio visuals, the food and beverage right, at the breaks time? So you still have all that. And now you have, let me know about your food and beverage protocols, about this safety, the ventilation, tell me about that. And do they have company standards? So our questioning to our clients has changed, and the client's questions for the hotels have changed. And the only advice I can really give from a client side is really make sure you're asking the questions. Is there anything else that I need to think of as a client that I'm willing to bring my team members in, where we want to get together for a meeting? It's been a year and a half. We need to meet. We need to be together to make this program happen. But I'm just not sure. So most companies have a program. Like I said, we have our EverStrong program, which is hotel wide, and then EventStrong, specific to hosting meetings, events, wedding receptions, galas. And all of that is tied into your local restrictions and how those are updated. But making sure you're asking the questions so that there aren't little things that are missed, because we take a high degree of pride at Southern in all the things we do. We have multifamily, hospitality, and office, and we roll these programs out company wide because we want to make sure that that environment, no matter where you're at, is consistent and we're performing. So asking questions, if you're not sure, is the safest way.
And are you seeing an increase in business, now that vaccinations are occurring and being distributed?
We're seeing an increase in hope. We are seeing people starting to plan to have events. We're seeing more leisure travel. Leisure travel is definitely coming back. People are traveling as families, and at our hotel at the University of Maryland and Cambria property in College Park, starting to see college visits and visits to campus. Our Hanover property, we're seeing visits to the casino in Annapolis and other areas. Our resort property, Bear Creek, up in Macungie, Pennsylvania, it has done better because it had outdoor activities. It had skiing. It has outdoor pools and activities and bike trails and those kind of things that actually did well in the fall, and obviously skiing in the winter, because people obviously were safer outside. We had a lot of protocols in for that. But as we're seeing this summer, we're starting to see the indications that travel is coming back, starting at the resort and shore properties, coming into suburban, and eventually toward the city and meeting properties. But leisure travel first, and now we'll hopefully see some government, association business, eventually some meetings business.
And Steve, I heard, or not heard, but I read, CDC is still saying don't travel. Am I right?
For those that have been vaccinated, as I understand it, their latest recommendation is it's safe to travel, but they are still recommending to limit the unessential travel, just to limit the potential spread of variants that for asymptomatic spread. For the cruise ships, they do require, you're talking about marketing earlier, as part of their marketing materials, when anyone is booking a cruise, they're required to inform them about any sort of protocols or CDC travel warnings that are in effect. So they kind of have to red flag it for the customer, for the client, so to speak, for the passenger who's wanting to book a cruise. So they're fully informed about that. Also, when they do come back to cruising in the out of U.S. waters, they're going to limit the cruises to no longer than 7 days. So you won't have those long exposures of 14-day, 10-day cruises where people will be exposed over longer periods of time. Everyone will be tested prior to embarkation, and anyone with symptoms or testing positive or with symptoms will not be allowed to embark on the cruise. And all the passengers and crew members that are disembarking will be tested as well prior to disembarkation with, as best I can tell, the rapid test, because they're going to have to have a quick turnaround time for the disembarkation testing. So those are all protocols that the cruise ships will have to follow in order to sail from U.S. waters and get the conditional sail orders.
So let me see if I get this straight. So you have to test before you board. So is the cruise ship testing you, or you have to show up with already your test done?
That I'm not clear on. There is, let me see here. Cruise ship operator. I'm sorry, read this directly from
Sure.
CDC's quotes here. Cruise ship operators must screen passengers and crew before they embark for signs and symptoms or known exposure to COVID-19 and deny boarding to anyone who is suspected of having COVID-19 or is identified contact of or confirmed or suspected cases. And also the next one, 4, excuse me, I'm sorry. The cruise ship operator must conduct laboratory testing of all passengers and crew on the day of embarkation and the day of disembarkation. So this indicates that the cruise ship operator must conduct the laboratory testing. So
Well,
that's
a whole new process for embarking, I imagine.
Right. So those are the reasons that they have to have all these plans in place, and they're moving in phases. And there's lots of steps to make sure that they follow all these protocols properly. And that's another reason why they're going to have these simulated cruises, so that they can actually put into effect these protocols in real world scenarios and see if they're effective.
And the fact that they are going to be doing the testing, to me sounds like that's a whole new group of folks that they're going to have on staff to be able to do that as well.
They have, that's part of the conditional sail orders, as well as to make sure that the medical staff on board the cruise lines and at the ports themselves within the companies have the ability to perform all these requested actions.
Has the capacity of the ship, the number of people that can be on the ship, also been adjusted, or if everything goes great, they're going to be sailing at full capacity?
They'll have to be able to social distance in venues like for entertainment and meals, services, those types of things. So that will be the dependent number in terms of what the capacity of the cruise ship can be. Is can they have enough services and enough social distancing within their venues to provide for a certain amount of customers. So that'll be the limiting factor, not necessarily a specific percentage, but can they meet the protocols of social distancing in their entertainment and public spaces.
And Jeff, with regard to hotels, is there a capacity issue that you guys have to be in compliance with?
For the guest rooms, no, because they're self-contained units and you have separate air and that. But for obviously your public areas, any meeting events, things like that, then yes, there's capacity. 50% generally for your meeting space, which if you're doing 6 foot capacity, depending on your seating, you may or may not get to that level. One nice thing with meetings and events, if you have a good amount of space, as we do at a number of our properties, you can space and do it effectively and utilize more space than you typically would to increase that level of comfort. But from a guest room standpoint, no. But elevators, public areas, spas, fitness centers, pools, all those are limited by capacity limits and physical distancing requirements.
And how have the guests behaved as they've been coming to your properties? Have they been compliant, or has it been difficult?
Actually, generally, it's been very, very good. Even with a busy ski resort, we've limited mountain capacity and limited capacity in restaurants and public areas and things like that. Most people get it. They're happy to be out and don't want to necessarily jeopardize, their good time or really anybody else's. The stories where people don't behave, they get a lot of news. And do you run into them? Sure. But it's certainly not the majority. The vast majority of our guests that we've experienced have been, positive and compliant with the rules. It's making sure that everybody understands and you're communicating with your guests what the local restrictions are. In the beginning, when there were differing mask requirements and things were changing, that was obviously a more challenging time because my state had this and this municipality may have that. And so once things got more unified toward the end of the summer and early fall, it certainly became a lot easier. It wasn't that they were necessarily difficult, but one municipality to the other could have been very, very different. And even within a state such as Maryland, we had 3 or 4 municipalities that had tougher restrictions than the rest of the state. So making sure you're communicating with your guests consistently and visitors. If you're communicating and let everybody know what the expectation is, we found that obviously the compliance and the enjoyment of our guests was great.
And what about staff? How, because they go home, right? They're not staying there 24/7. How do you guys test, or what do you do to ensure that you don't have a staff member coming who's asymptomatic? They honestly don't know that they may have COVID and they're at work.
Well, I'm extremely proud to work for Southern Management Companies. We, right at the very beginning, our CEO, Suzanne Hillman, really made the statement and stuck with it throughout, that the safety and well-being of our team members and guests and residents was paramount to anything else. We invested in PPE and put a committee together immediately that we still meet 3 times a week and review, what are we doing and how are we doing it for every one of our locations, not just our hospitality locations, our apartment communities, commercial. So we have a very robust backbone supporting our policies, which mirror most restrictions and policies in place for our municipalities. But from a self-quarantine, return to work protocols, daily screenings, and follow up, but more importantly, the use of PPE and spacing and barriers has been essential. Because you're right, if somebody's asymptomatic and feeling fine and coming on, that can be an issue. But if you are consistently washing your hands, sanitizing, wearing masks that we test regularly and stayed ahead of, whether it was 3-ply non-medical to filter to now we encourage KN95s, and we supply that for all of our team members. And we also encourage those practices once they leave the property. We've actually been very lucky. We haven't had any significant issues at any property. We haven't had to shut down. And because we've stayed on that and have that policy and that really engaged culture, it's allowed us to not only keep our team, together and generally healthy, but to take care of our guests and residents throughout this pandemic. So, for us, because of the commitment of our entire company, that just became our culture. So we need to take care of our guests. We've got residents that are depending on this. This is what we need to do. And, for us, it really has been a very positive experience in a very challenging environment.
And Steve, I'm going to ask you something that doesn't have to do with cruise ships whatsoever, but for those who are hesitant to get vaccinated, what do you tell them?
Well, I tell them that the science is there, that they're safe and effective, and that the vaccines that have been approved through the US FDA's emergency use authorization process are you should get any one of the ones immediately that are available to you. They're all effective in reducing severe illness and death at a 100% level at this point. So and it will help facilitate all of us getting back to traveling to resorts, cruise ships, and getting back to our new normal, which is what we're saying now, obviously. So get vaccinated and get the first one you can.
Awesome. And there has been a little bit of hesitation about Johnson & Johnson, but you think that one's good too, right?
Yes. What's been out about Johnson & Johnson was a manufacturing issue at one particular plant in Baltimore. And those, unfortunately, some 15 million doses had to be discarded. But that shows you how the safety protocols actually are in effect. And even for manufacturing issues, they get flagged before it gets into the distribution system.
So it works. It works. So you hear
Yes.
that, everybody? Get vaccinated. So we are out of time. Thank you so much to both of you for relying all our concerns about travel and staying at a hotel or taking a cruise. I'd like to thank my audience for watching. You can catch us on YouTube, channel 21, Montgomery County channel 21, and we're on Facebook. Thank you. See you guys later.